and that is an extraluminal air collection. That indicates that this is an abscess. On the right is a barium enema that shows filling of the bladder. That's that central connection in the pelvis. That indicates a colovesical fistula. This is a coronal CAT scan that shows a colovesical fistula. You can see the arrow points to a loop of sigmoid colon that is adherent to the bladder and creates a connection between the two. This is a good slide to show the relationships of the sigmoid to the bladder. How is diverticulitis managed? Well, I'll just touch on this briefly. Again, very simple microscopic disease is treated with antibiotics. We usually use a fluoroquinolone like Cipro or Levaquin and a drug that covers anaerobes, and that usually is Flagyl. And patients usually are treated 1 to 2 weeks and usually resolve. Those that have recurrent disease, and again defined by 2 or 3 or more episodes, those patients have a high risk of yet another episode, and elective surgery is an option. The complicated disease often requires surgery. Those with abscesses can be drained by interventional radiology. Some diverticulitis causes a stricture or inflammatory narrowing of the colon, and that may require surgery, or in tertiary care centers, a stent, endoscopic stent, to open the colon up and allow for an elective surgery. And fistulous disease also requires surgery to repair the abnormal connection. And lastly, free perforation or peritonitis is a life-threatening event and requires emergency surgery. Bleeding is the second major cause of complications. It's seen in about 15% of the diverticular cohort. And again, remember the slide of pathophysiology. The blood vessel is at the dome of the tick, and erosion causes bleeding. It's usually painless. Interestingly enough, it's usually a non-inflammatory condition. There's usually not diverticulitis. And 5% of patients develop massive hemorrhage that may require radiologic or surgical intervention. Now, the less common complication is something called diverticular colitis, and this we see often in the endoscopy lab when we scope patients. It is a segmental colitis. It involves usually the sigmoid colon and is seen amidst the diverticular disease. It was first described by Mark Peppercorn at Beth Israel and Harvard in the American Journal of Gastroenterology. And it ranges from no symptoms to a condition similar to inflammatory bowel disease. Patients can develop abdominal pain, diarrhea, and it results in an inflammatory change amidst the diverticular orifices, and also one can see submucosal hemorrhage. These little spots are called Fawaz spots, for those that want to impress their friends and family. The etiology is not known. The thought is perhaps high pressures cause trauma to the lining, that there's prolapse and squeezing of the folds, maybe stasis, ischemia, and another unexplored etiology is altered bacterial population. Again, here's the endoscopic finding. You can see these almost look like bruised folds, and again, most of the time no symptoms are rendered, but sometimes this can result in a diarrheal syndrome. And here's an endoscopic picture of diverticular hemorrhage. Often we don't see this bleeding from one tick. The most common thing is looking in and seeing clots and hundreds of diverticular orifices and trying to guess which one is the culprit, is the needle in the haystack problem. But in the rare circumstance where you can actually see the bleeding site, you can place endoscopic hemoclips, as was done in this slide. Now, who are the patients that get complicated diverticular disease? Well, again, patients with connective tissue diseases like Marfan's and Ehlers-Danlos. Patients who have transplants, who take immunosuppressive therapy, often have complicated diverticulitis. We see it a lot in patients with renal transplants. Non-steroidal anti-inflammatory agents, also increase the risk of diverticular hemorrhage. We often associate it with gastric ulcers, but diverticulosis bleeding goes up with the use of aspirin and NSAIDs. And dietary issues, very fatty foods have an increased risk of diverticular complication, and complications also go up in age. Now, how to prevent the disease? Well, fiber is our best bet and really is the only medical therapy that has some data behind it. Most of the data is indirect. Those societies with high fiber consumption have lower risk of diverticular complications. There's been several unblinded studies. The most notable was in gastroenterology in '79, where the introduction of fiber reduced diverticulitis. And a very large study that was started in 1986 involved health professionals found the higher the insoluble fiber use, the lower the diverticulosis risk. Now, in terms of dietary recommendations, what do we do about nuts and seeds? Now, for many years, health professionals told their patients not to take any nuts or seeds if they had diverticular disease. The idea being that something got caught in the diverticulum and poked a hole through it. Well, this was tested again in a case control study, the health professional study, and here is the data in depth. Almost 50,000 men, middle-aged men, were enrolled. They were followed for up to 18 years. They had a food history taken every 4 years. They had no diverticular disease at the beginning of the study. And they were divided ultimately into two groups, a high nuts and seeds intake and a low consumption group. And lo and behold, when they looked at the intake, they found that those that ate nuts and popcorn had a lower risk of diverticulosis complications than those that abstained. And the conclusion of the study was that consumption of nuts and seeds not only was not harmful, but lowered the risks of diverticulitis. So what can we say about diverticulosis? Well, it's a common disease. We were unfortunately afflicted with this when the decision of the millers in the 19th century decided to roll the grains. The treatment is dietary. The cause is dietary. 1 out of 5 people may incur complications and end up in the endoscopy or the surgical suite. And to those that want to have their nuts and popcorn, go ahead and eat. And again, I leave you with this. Here's Homer Simpson enjoying his Orville Redenbacher, and in the 20 years of the Simpsons, not one episode of diverticulitis. Thank you very much.